My name is Tamara, but you could call me Tam. And as Gertie mentioned, I am the founder and president of Maternal Matters Favored. And so we work with the population that are there in the perinatal and postpartum sector. And what this looks like is regrettably, a lot of times, too often, moms go through levels of anxiety and depression. They have panic disorders, OCD, PTSD, and everything else in between. Prenatal, meaning while they're pregnant, as well as, sometimes afterwards. And so what we're seeing here, and we provide counseling, support services, we do workshops and everything else. But what we're seeing is that a lot of individuals are just being told, you just had a baby, you're fine, what's going on with you? Don't worry, kind of a thing, right? But they're having these symptoms of guilt and shame and feeling hopelessness, they're feeling thoughts and emotions of anger and rage and irritability, and they have lack of interest of doing anything baby related and so forth and so on. And how this ties in with Medicare is that Medicare does cover some pregnancy and child delivery costs. And where individuals may not realize is that a lot of individuals are actually on Social Security disability. And so that's where that Medicare comes in. And it's not just thinking, okay, Medicare, person is over 65 and this is what's going on, right? According to CMS, when we look at their Medicare benefit policy, Medicare pretty much covers reasonable and necessary types of medical coverage, but this is only with sometimes a specific diagnosis, continuing through a person having the delivery taking place, and pretty much it ends after the 12-week kind of a checkup. But what we're seeing is that there are ongoing issues that are taking place or developing within moms in which they're now needing additional coverage for. And so what we are pushing and want to get to place with legislation is that there needs to be an extended type of coverage for those that are on these federal healthcare programs, so they can actually get continued healthcare services as well as mental health services. With the bills that just took place and passed, and a lot of us was at the Hill last year in lobbying, where now individuals are being forced, into longer terms, going full term with pregnancies, right? And so where we had so many staggering numbers of anxiety and depression because, individuals are like, oh my gosh, I don't think I can do this. I can't have this baby. They have these certain situations in which they became pregnant, right? And so forth. Now they're being forced. And so we're starting to see an incline of the requests and services because individuals are actually, the numbers are increasing with regards to the anxiety and depression and the levels of postpartum psychosis that are taking place. And so when we look at a cause and effect and how this is an ecosystem, this is one thing in which it is. But I do want to say this, when we start to look at some of the risk factors of perinatal and postpartum mood disorders, if a person has a history of depression, anxiety, or OCD, chances are higher they're going to develop prenatal or postpartum mood disorders. If there's a thyroid imbalance, diabetes, there's a whole slew of endocrine disorders that sometimes take place and knock things off kilter. If there's a lack of support from friends and family, these things tailspin a person into those levels of anxiety, depression, and psychosis and OCD, right? Sometimes what we see here as far as high risk factors is that if there were complications during a person's pregnancy or delivery, or if there were some situations of infertility or miscarriages and things to that effect, that forms a level of PTSD and so forth. And so all of this really ties in. And I have a slew, when we start talking about social economic levels, you know what I mean? A person could be financially stressed or living in poverty. And here we go. Oh my gosh, I'm about to have the child. How am I even going to pay for diapers? Can't even put food on the plate, for myself and things like that, and so forth. And so once more, we really need to push and advocate for longer periods of healthcare coverage that provides once more, not just for the person physically, but also for them mentally. Because what we are pushing and working to do here at Maternal Matters Favored, is not just the counseling, but there's support groups where we have opportunities for folks to be able to vent. Let them know that it's okay to feel how you're feeling, but you don't want to remain stagnant there. Don't fall complacent, right? There needs to be more programs centered around medication treatment, where we think about levels of bipolarism and things to that effect that can help, regulate a person. There's yoga, right? But a person, if they can barely put food on their plate, then this simple thing, this it becomes even more burdensome to them, and so here goes their levels of anxiety increasing and so forth. And then of course one of the things that we know is so true is that it costs less to eat junk than it does to eat healthier foods, right? And so when you're putting garbage in, your system is once more is not it's going to react accordingly. And so it would be ideal if we can get more healthier foods. But of course, this all comes with coverage. If a person is able to get additional levels of SNAP, things to that effect, WIC as normally deemed for a person and so forth. These things will actually help. And so it's our goal here at Maternal Matters Favored to keep, pushing the needle and helping parents as much as we can while they try to balance parenthood and life at the same time, to the point that we actually every year, and Gertie participated last year, we held an annual broadcast. It's kind of remembrance of Jerry Lewis telethon, where we broadcast for 24 hours talking and interviewing with folks just to let them know about this silent crisis and how we can steadily find ways of combating it and raise awareness and so forth. And so we do have our annual event coming up May 11th. We broadcast once more for 24 hours. We end on Mother's Day, which is that niche and that homage. And it's my hope and prayer that we can see some of you all there. Thank you for your time.